Hello and welcome to another episode of the Caring Support Podcast. Here with me today is Sandra Mutilva, healthcare leader and mentor. Welcome, Sandra. We're so excited to have you with us today.
Thank you so much for having me.
I hope I didn't mess up your last name too much. As I was saying it, I was like, I don't think I really checked this first.
No, you didn't know. You said it perfectly. Thank you.
Awesome. So we've talked a little bit in the past, and there's been some recent developments that I saw on LinkedIn that are super cool. So if you don't mind, I'd like to talk a little bit about one of your recent posts where it says that you've been selected as a finalist for Ms. Canada 2023 pageant that's happening on July 16th. And I just wanted to talk about that a little bit. That is super exciting.
Oh, that is something. That is something. It came from nowhere, right? I just was in contact with people who did participated in the pageant. So I said, I started to inquire a little bit more, and they said you should be there, and these are great women, very. So I said, okay. So I put my name. I said I'm going to wait. But then one day I was in Instagram and I saw that they were looking for participants. So I said, okay, I'm going to put my name. And, things start to develop. And then right now I was selected as a finalist. So my cause is about bringing more awareness about the lack of research and innovation related to menopause. Right, I am an advocate in terms of, my past is as a midwife, so I am very passionate about women health. So yes, this is what I will try to highlight as my cause.
Well, that's a great stage to display your cause on. That is so cool. When I saw that pop up, I was like, this is amazing.
Thank you. It's going to be fun too, because this is completely outside of, my comfort zone. So let's go out and show this issue to the world, because Miss Canada is a great platform to bring these issues forward.
Yeah, of course.
There are really great causes there. Each participant has an incredible humanitarian or social justice cause. So yeah, let's see how it goes.
That's amazing. And yeah, it gives you a platform to kind of inspire, the younger generation and people that are coming into healthcare and coming into research and all that kind of stuff, to use platforms like this to get their causes out there. That's amazing. And I think it's super cool. And I'm really happy that you're able to be here with us today and to share that with us. So,
thank you so much.
Yes, and congratulations. I mean, obviously, you're a finalist.
I was not prepared to answer this question, but anyway, that's fine.
Well, outside the Miss Canada 2023 pageant, maybe you want to tell us a little bit about yourself, who you are, what you do, all that kind of fun stuff.
Yes, so I am an immigrant. So immigrated in Canada in 2004. I was born in Argentina, and I went to school there. I got my bachelor's in health science in midwifery, and I practiced midwifery there in Buenos Aires, where I am from, many years. And I also was involved in some global health initiatives through the World Health Organizations and other NGOs. And then in 2004, I migrated to Canada. I went through bridging program in order to have my license as a midwife. So I was able to get registered with the College of Midwives in Ontario. And I practiced midwifery here in Ottawa from 2005 to 2018. So I practice in the community. I also deliver babies in 2 hospitals here in Ottawa, one at the Montfort and the other at the Ottawa Hospital, where I also serve as a chief of midwifery. I also co-founded Ottawa South Midwife, so I have a great career, but At one point, I decided, okay, I would like to expand a little bit more about my leadership. So I went back to school and I got the Executive MBA at Telfair School of Management. When I finished in 2017, I said, no, what? No, what am I going to do? So I stopped doing clinical care and started working as a consultant. And then the pandemic hit, and I said, now, okay, let's see where I can take advantage of this time. And I decided to embark in finishing my PhD in organizational leadership. And I am very close to finish. I'm probably going to be defending. I am disserting right now, and I am probably going to be defending in October. Yes, and my PhD is in organizational leadership, and it is through Adler University in Chicago. Yeah, this is a very high overview of my career.
Oh, no, but that's amazing. It's amazing to see the steps that you've taken to get to where you are. And I mean, congratulations. You've done so much educational work and you're going to finish up another one here in October. That's amazing. So congratulations on
Yeah.
that too.
Thank you, thank you. Let's see how it goes. Because right now my life is absolutely devoted to my research. Yeah, so.
You mentioned that you immigrated to Canada and now you're living in Ottawa.
Yeah.
What is it like working in Ottawa? What are the things that you enjoy about working there, living there? Maybe you could give us your favorite places to hang out, all that kind of stuff.
Yeah, so Ottawa is really because I coming from a very big city, which is Buenos Aires. So, but Ottawa, I have been living in another places, so I have the opportunity to travel, but I always come back. So, Ottawa is big, is small, but also is big. It has lots of diversity. It is the second diverse city in Ontario after Toronto. So there is a nice sense of community. There are opportunities to work, especially right now that there is more flexibility from working from home or hybrid models. Also, there are things to do right now that the pandemic is over. There are more festivals. There is more openness in terms of activities. I like also how close we are to nature. We are very close. I am very close to the Ottawa River, and also. If I cross basically the street where I live and I am in the middle of some kind of a forest, which is great to ground myself, meditate, see nature during the day. I am also a runner, so Ottawa is a safe city, and so. And also, it's a very good to raise a family. There are great schools, wonderful universities. Some of them, they are top rank in the world. So, yeah, so this sense of community and also fun is something that brings me always back. And the aspect of feeling safe too.
Yeah. That sounds awesome. I'm actually a transplant to Ontario. I only moved here about 6 years ago now.
Yeah.
And we live way out by Lake Erie. So we're way down south. I'm about 6 or 7 hours south of Ottawa, but I haven't been to Ottawa yet, but it sounds beautiful. And I think I'm definitely going to put it on my bucket list.
You have to come and visit me.
Yeah, exactly.
Please. Yeah.
So while you've been exploring Ottawa, you've had this amazing career and you've actually done some work with risk management in terms of its importance in healthcare. So maybe you could talk a little bit about that. Why is risk management so important in healthcare?
Yeah, so risk management is complex in every every single industry, but in healthcare there is another layer of complexity, because the industry look after the well-being of people. So by definition, let's put it like risk management is a set of operational, clinical, administrative set of mechanisms to prevent, assess, and mitigate harm. So in terms of why it's important, there are three main things that come to my mind right now. One of them is about, as I mentioned before, in the industry we are looking after people, and the industry, healthcare, they are humans working, right? And we are not perfect, we make mistakes. So it is important in that aspect to have those mechanisms to, a mistake or an error can cause devastating issues. And in fact, there are some statistics. For example, there is a report from CIHR 2021-2022 that says that of 17 states, there is one incident. In the hospital state, there is one incident. So if we put that in perspective, there is about 2.9 millions of hospital stays in Canada. So that means 140,000 more or less incidents in a year. So this is a interesting number. The other aspect is also reputational risk. When there are incidents that damage the reputation and the trust that the community has in the organization. And also hospitals or healthcare organizations need the community. Because the community also is the main stakeholders, not only for good initiatives or philanthropic initiatives, but also to bring visibility to the problems that are happening in the community. And the other aspect is financial. So errors can cause an organization loss of money in litigations, in also settlements, and so these are the main three things that I am thinking about why it is important. Yes. So I hope I answered your questions.
Oh no, that was perfect. It kind of leads into the next question, where we're going to kind of talk about the high turnover rates with nurses and healthcare workers, and how that can definitely be a big factor into what you're thinking of when you're looking at risk management. So what changes do you think that healthcare organizations should be making to their leadership in order to combat these high turnover rates within our healthcare system?
So some reports are saying that around over 60%, I think that it might be higher, organizations are reporting lack of human resources or high turnover. And you know, you are more familiar probably because this is actually what you guys are doing. So obviously this speaks volumes related to leadership. I think that this is showing a lack of leadership that probably generated this problem that we are having. And when I read some of those reports, I think that there is always the same people there, you know, writing this report, trying to find solutions. And you are not going to, I think it was Einstein, I don't want to paraphrase him, but there is something that says that you cannot expect something different if you are doing the same things. So we need different perspectives to lead with the problems that we are having right now. okay, I can talk about organization, how important is the culture in an organization, but those are things that are more obvious. But I think that we need, in healthcare right now, we need a more futuristic agenda. And when I talk about a futuristic agenda, we are saying, I am not saying something that is between now and 10 years or 5 years. It's something that it is 1 year from now, right? It's try to incorporate more technology, have more interoperability, more, let's see, facilities for education. When we are talking about education of healthcare providers, start to also incorporate technology like virtual reality, augmented reality, artificial intelligence in order to customize the. I am also teaching in the Toronto Metropolitan University. It's trying to customize the needs of education to that particular provider. So he or she or them are going to be inserted or having a better transition when they start working. And for that, we need more money in education, right? So yeah, it's like, for example, have more facilities for student loans because those things are expensive, and scholarships. I am a student in the USA, and the amount of money that goes to healthcare education is incredible. And it would be great if Canada started to adopt some of those strategies, like more facilities with scholarships, better student loans. You know, if right now a medical student wants to go to school, it's impossible to do it, you know, using OSAP, right? Just to put an example. So yeah, these are some of the things that probably because these changes has to come from the high level. Yeah.
So you are working on your PhD right now, and you said you're going to be finishing that up here in the fall, but you're focusing on the reliability of research using AI for women-related health issues, which you're looking at like new technologies aimed at improving women's healthcare and like the advancements that we've had in recent years. Specifically with AI, so artificial intelligence, when it comes to cancer diagnostics. Why are these advancements so important for women's health specifically?
Yes, one of the things about AI is that we know that AI needs reliable data in order to function and to have what it is good AI. So right now, one of the main gaps in health research is that it has, you know, more of the applications that are in women are based in also in men, right? Because it has not been a good differentiation of sex in medicine. So men subjects are the main are the predominant population in some of those clinical trials. So what I am trying to assess is the reliability, basically expert opinion, about the reliability of AI in women's health. We are applying AI in women's health based probably mainly in subjects, male subjects. So how reliable is that? So yes, it has been lots of evolution in terms of women health, but there are still lots of work to do. I mentioned menopause at the beginning. Is one of the areas that is like a black hole in terms of there is minimal research and they are not the only. Probably the only solution is hormonal replacement therapy, or as one of the main treatments for the discomforts and an issue that a menopause person might have. Just to put an example, some of the, let's put it, that I encountered through my research is some of the let's put in machines that are being used in women for diagnostics. They are not invented by women, right? And
Yep. Yeah, I think I've heard that a few times before.
yeah, so it would be great if we have more biomedical engineers that are women and start to really do a complete engineering in elements on things that are being applied for women that are not friendly design. I was a midwife and I was sometimes seeing things or instruments, and obviously they were not invented by women, right? So this is something that I think that we need in terms of better innovation, to put it like that, and bring Sandra, because after oncology, there has been minimal advances in women health research and issues.
Well, to me, it sounds like, you are going to be one of these women that's going to make some of these changes or be inspirational to some of these changes. So I think it's really exciting to hear about what you're researching and the different perspective that you're going to bring into this. Because, yeah, like you hear about, women saying like, oh, yeah, it must have been a man that invented such and such a tool for, women's diagnostics. But, we need to change them up. We need to come up with different. There needs to be advancements. And you're right. It's going to take technology. It's going to take finances. It's going to take all different kinds of things. And it's going to take people like you that are willing to do the research and do the work and stuff too. So thank you for what you're doing. That's amazing. And before we come to the end of our podcast today, which I can't believe it's already come to the end of it as it is there anything else that you wanted to share with us or talk to us about today?
I think that I mentioned before is that we need a complete switch in the leadership paradigm in healthcare, because I am hearing the same things over, and despite the fact of some initiatives out there, so we need a little bit of more new ideas. Don't be afraid of disruption. Leverage more technology. Don't be afraid of the technology, but also apply it with caution. And also invest more in education, especially for racialized people. There is something very important in healthcare that it has been researched that is called concordance. Right. So, for example, I am an Hispanic woman, and it would be. I understand my culture, so it would be great if there is also more encouragement or more money going to prepare racialized communities to be the next generation of healthcare providers. Yeah.
Well, thank you so much for being with us today, Sandra. It has been amazing talking with you. And I can't wait to see what happens with this Miss Canada 2023 thing. I'm going to be watching and I'm going to be like, I know her. So
thank you.
Yeah.
Thank you. So let's see how it goes. And if not, okay, I try it.
You know what? That's all anyone can do is try, put themselves out there and try. That's the biggest thing that we can do as women, as entrepreneurs, as anything, is just to get out there and try, and you're doing it. So congratulations. And hopefully we will be able to connect with you again in the future to see where your PhD heads and what happens with this pageant. And yeah, thank you again so much. It's been really great talking with you today.
My pleasure. Thank you so much for this wonderful opportunity. I wish you all the best, and let's be in touch.